When we're feeling depressed, even the smallest action can feel like we're moving a mountain. Like the act of getting out of bed can feel super hard. And as a result, when we try to set goals in depression, we're often setting ourselves up for failure, and then we feel ashamed because of it, and then we feel even worse. So in this video, I'll be talking about SMART goals and how we can use the idea of SMART goals to be able to get you closer to your goals, break out of the depression cycle one step at a time. Hi, if you're new here, my name is Parky. I'm a postdoctoral fellow in clinical psychology at Stanford University, and as a mental health practitioner myself, I often work with my patients in therapy to make sure that we're setting the right goals for them to be able to set them up for success rather than feeling like therapy is another failure experience. So before we talk about SMART goal setting in the context of depression, we first have to define what are SMART goals. So SMART goals are an acronym that stands for specific, measurable, achievable, relevant, and time-bound. So let's go into each one into a little bit more detail. So when we think about SMART goals are first of all specific. So when I think about specific, I think about a clear, actionable strategy that a person can engage in terms of changing their overall behavior. So goals like being happier or being more social, while obviously incredible goals, they're not actually particularly specific because people can have very different definitions of what it means to be more happy or more social. But a more specific goal would be something like spending 5 minutes a day talking to a friend. That would be a much more specific goal towards the goal of being more social. Or, if we're thinking about being more happy, maybe that means rating their mood at least a 5 on 10 every day rather than a 2 or 1 on 10. So along with being specific, SMART goals are also measurable, which means you can kind of measure how you feel, for example, before or after engaging in an activity. So for example, let's say after you take your 10-minute walk, you might be able to rate your energy levels from 0 to 10, 0 being no energy at all to 10 being very high energy. Or after you do an exposure practice, for example, you can kind of rate how you were feeling when you were engaging in the initial exposure, being exposed to the spider or whatever it might have been, and then rating how much your anxiety drops as you're engaging through the exposure practice. Next, SMART goals are also achievable, and this is particularly important because first of all, when we set goals, we want to be able to set ourselves up for success. We don't want this to be another failure experience, feel ashamed because of it, demotivated because of it, and then kind of like stop doing everything altogether. And this is particularly, again, important in the context of depression where we already feel kind of unmotivated. We already feel sort of a low self-efficacy. We already feel bad about ourselves. We don't want another failure experience. So we want to make sure that the goal we're setting is actually consistent with what is achievable given how we feel in the moment. So if we haven't ran for like years, we don't want to set up a marathon or a half marathon on our first day back. We might say, okay, we'll take a 3-minute jog and then we'll see how we feel from there. And that is our definition of success. So along with being specific, measurable, and achievable, SMART goals are also relevant, meaning that it's germane or relevant to the actual thing that we're trying to achieve. Like if we're trying to be more sociable overall, then it would make perfect sense for us to interact more with people in our lives, call up our mom for a dinner date, or things like that. On the other hand, if our overall goal is to be more fit and athletic, then maybe these same goals of interacting with people make a little bit less sense in the context of what we're trying to achieve. And finally, SMART goals are time-bound, which means that there's a point in time where you know whether or not you've completed the goal. So for example, a time-bound goal would be something like taking a jog 3 days a week for at least 15 minutes. So at the end of the week, you can kind of reflect whether or not you've achieved that goal. And in that case, there's actually a timeline as to when you need to accomplish that goal by. So the reason why SMART goals can be so helpful in the context of depression is that when we feel depressed, we have very little resources to be able to handle life stressors, and we don't have a lot of motivation to be able to get started in the first place. So SMART goals help us get started by doing something that is small and achievable to really build up that momentum, get past the sort of initial feelings of resistance and avoidance, and start to build momentum towards the ultimate goal of feeling better. So before we start SMART goal setting, we first want to identify what are the different bins or types of behaviors or activities that we want to reintegrate back into our lives. And in behavioral activation, which is an evidence-based treatment for depression, they outline 5 different categories of activities. Number 1 being activities of joy and pleasure, so things that you used to enjoy. Activities of competence and mastery, the things that give us a sense of efficacy and competence into our lives. Activities of social connectedness, the things that can cultivate our relationships. Approach activities, which are the things that we typically avoid and now we are trying to approach, like maybe sending an email or something that we've been procrastinating on, as well as activities of meaning, the things that really give our life a sense of meaning. So at this point, it's kind of a choose your own adventure in terms of what are the activities that resonate most with you and is most consistent with the areas you think would give you the biggest bang for your buck. But just to give a couple examples of each bin, for example, activities of pleasure, this could be making yourself a cup of coffee every day or a cup of tea every day, or listening to music for 5 minutes every single day. For activities that build a sense of mastery and competence, this could include cleaning your room in the morning or taking 15 minutes every day to learn a new instrument or learn a new language or doing your homework, whatever it might be for you. And for SMART goals related to social connectedness, this could mean calling your mom in the evening once a week or spending some time finding a new hobby and attending those events and interacting with at least one person, whatever that might be for you. That could be something that increases your sense of social connectedness. And for approach related activities, SMART goals could include things that you've been avoiding, like sending an email, having a hard conversation with someone, or if you're applying for a job, it might mean spending 5 minutes on your resume every single day, or finding at least 2 different jobs that you could apply to on LinkedIn or Indeed or wherever to be able to slowly get towards that broader goal of finding your job. And finally, activities of meaning are going to be very specific to yourself. So it might be related to relationships or health or whatever it might be for you. Make sure to kind of really hone in on what is truly important to you, and then set SMART goals that take you closer and closer towards that North Star. So for example, if your value is health, then you might take, 5 minutes every day to walk or do some yoga or drink at least 1 cup of water in the morning every single day to make sure that you are well nourished throughout the day. So when it comes to setting SMART goals, especially in the context of depression, but really in general, it's important to really set yourself up for success. And one thing that can be so important is to make sure that first step is as small as possible so that it reduces the friction of just starting. So even if it means saying, okay, if I just take 1 minute of a walk, if I just open up my document and stare at my homework for 30 seconds, that's going to be a success for me. That will help reduce the inertia between stopping and starting to be able to set yourself up for success. Another way to set you up for success is to reward yourself for completion of the activity. Like for example, if you are working on your paper, you might reward yourself by going to the movies after you finish the paper, or to reward yourself with a Skittle every time you finish a sentence. Whatever works for you, you can kind of use that as a reinforcement to continue doing the work that you're supposed to be doing. And finally, you want to address any obstacles that could potentially get in the way. Like for example, maybe your goal is to jog at least a few times over the next week, but you know that some things could come up. Like for example, if you have a meeting or if something else comes up or you're just feeling really, really tired, what are the things that you could do to make sure that you really set yourself up for success? Maybe it means scheduling at a time where you know you're going to have a little bit of free time, or scheduling at a place where you already have your joggers on so that you can immediately jump out and go on your jog. Whatever that might be for you, you really want to make sure and be thoughtful as to what could get in the way of my goal and what are some things that I can do, some stipulations I can set, some ways to set myself up for success. And as a quick temperature check with my patients, I usually like to ask them 0 to 10, how likely are you to actually complete this task over the next week? And if it's lower than a 7, then I don't want to set them up for failure. So I'm actually looking for a score of at least 7 on 10 in terms of likelihood. And if it's not 7 on 10, I'm going to continue working with them, collaborate with them to figure out what could get in the way, problem solve, and make sure that they're feeling competent and confident that they can actually achieve their goal and build that momentum over time. So remember, depression can make it really hard for us to act. It can make us feel super unmotivated, and it can make even the smallest thing very, very hard to do. So make the first step the smallest step possible, build momentum. You don't have to do everything at once. Take 1 step at a time, and I'm sure you'll get to where you need to be. Thank you so much for watching. I hope you found it helpful, and if you did, I encourage you to subscribe because I'll be continuing to talk more about evidence-based mental health down the road. Take care.